Hello. Okay, second video today. I'm just trying to get caught up on the videos that I had previously promised. The next video I had promised was, sorry, let's start again. It's still May 10th, 2023. El Día de las Madres, so it's Mother's Day in Mexico. I have to call my mother-in-law and tell her Happy Mother's Day. My goddaughter actually just came by and brought me some chocolates and flowers and a balloon, so very happy about that. Um, Going back to what I was saying, in my last video, before the one I posted earlier today, the topic that I left off with was my 6-week checkup with my oncologist. So it's been a few years, and I want to talk about patient advocacy and basically what got me to the point where I decided that it's time to start self-advocating. At my 6-week checkup, the same doctor that I had had so many problems with, uh, he came into the room and he said, everything's fine. There's no reason for us to suspect that you have cancer anymore, and we'll only need to see you every 6 months. And he was ready to leave. He never once checked my incisions. He never once asked me how I was doing emotionally, if I needed any help. He was obviously very angry that I refused to allow him to do my surgery. I've referenced this doctor in past videos, and I've talked about the whole Dr. Jekyll and Mr. Hyde thing. So this is a very by the book, non-holistic physician, which is fine. But bedside manner still matters. And the way that you treat people also matters. Things that I had never brought up in my video before that I'm more willing to talk about now are things that made me feel incredibly ashamed. This man, aside from ignoring a cervical block, which I discussed in a previous video, also would do things such as leave the room while I'm in stirrups and leave the door to the hallway open with nothing but a partition curtain between me and the door, where I'm completely exposed to the hallway. He refused again. He never once reviewed my incisions. He never validated a single emotion that I had. When I told him how important motherhood was to me, he responded by saying, well, I have 3 children and I wouldn't care if they had my genes or not. And while he's entitled to that opinion, and I think that somewhere underneath the callus, what he meant to say was that, or what I hope he meant to say, was that he loves his children enough that it wouldn't matter if they weren't his biological children because he would still love them that much. But that's not what he said. And every action up until this point made me hate going to him more and more. The amount of pain, unnecessary pain that he put me through, the way that he spoke in such a condescending tone. And, so many of these things that just fit under plausible deniability if I were to file a grievance, it left a really bad taste in my mouth. But at some point in my cancer treatment, I asked for my medical records so that I could go and consult with an infertility specialist here in Monterey County, where I'm located. And I got my medical records, and this was before my surgery, but after our discussion where he said that my hysterectomy was a necessity. I read my medical records, and I realized that every concern that I expressed to this physician was never documented. He never mentioned that I was unhappy, that I was unwilling. He never mentioned that I wanted to try to preserve my fertility. And I had doctor's notes from both him and the other provider, and it was night and day, because one provider had that I'm looking for a fertility sparing treatment. And the other doctor said in his clinical notes that she understands the surgery and she's willing to move forward. And it was more than just the words, but also the implication and the tone. Now, I have a wealth of experience with medical records. I've handled thousands of patients' charts. I've read notes from every specialty that you can imagine, from oncology to gynecology to podiatry to orthopedic surgeons' notes to infectious disease. I have spent enough time around these notes to understand, one, how they are going to be interpreted by an insurance company and by others, but also to understand that he was painting this picture where he was a hero and I was grateful and so helpful, and that he was such a wonderful addition to my medical care team. And the level of betrayal that I felt in reading all of those notes, they absolutely spoiled something in me. So when I went to my 6-week checkup that was supposed to be with the doctor who actually completed or performed my surgery, and found out that that doctor had decided to distance himself from this, I'll call him from this point on, beast. I actually decided to follow my other gynecologist oncologist to the clinic where he was at. I resolutely decided then and there that I never wanted to see this man again. I wanted nothing to do with him, and I never wanted him to touch me because he had violated me in every way that a physician can violate a patient. Um, I actually, I'm still angry at myself because I I actually filled out grievance forms and I was prepared to submit everything to my insurance. And knowing my insurance and knowing that I am an employee of one of the businesses that is owned by that insurance organization, I know that that man would never, ever again have been listed as an in network provider. And I could potentially have saved other young women from the experience that I had. I will say this: before you see anybody, a doctor, a lawyer, anybody, a tax professional, read the online reviews, read the Better Business Bureau evaluations, and trust them. I had read what kind of doctor he was. I had read about a specific malpractice lawsuit that was being held against him, and I figured, well, it's an emotional kind of cancer. And maybe these women were just very emotional and had high tensions when they were going through these things. But no. Mm-mm. Mm-mm. No, I decided to give him the benefit of the doubt. And I will say, don't ever, 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 as a woman, don't ever engage with a professional that has reviews for not listening to women. In the last few years, it has been wonderful to see how women start to get online now and advocate for themselves, and encourage other women to advocate strongly for their medical well being. That is also a tone that I will be adopting henceforth in my life, uh, because it's unacceptable. My very first video, I was talking about how nobody ever took me by the hand and explained to me that I wasn't having periods and I needed to do something about it. Nobody ever took me by the hand and said, you have polycystic ovarian syndrome. I had a ruptured cyst that I went to the emergency room for in high school. Why didn't anybody explain to me that that wasn't a normal thing? I was 17. If I had known at 17 the risks and the red flags, perhaps I would still have my wound today. So, Advocate for yourself as a woman. And if you are a woman of color, I hate to say you have to advocate that much harder. And if you need to change doctors, then change doctors. Do what you need to have or what you need to do. Reach out to your insurance and ask them to help you find another provider. Read your online reviews and treat them like gospel. Um, Advocate for yourself. If you're one of those people who does not like confrontation, chances are you have a confrontational friend or auntie or somebody somewhere that you're going to take in with you, and that is going to give that doctor their peace of mind. Bring somebody with you that can stand up for you and advocate for you, because it is unacceptable in 2023 for 16-year-old and 23-year-old and 27-year-old women to be diagnosed with a cancer because nobody would listen to them. Or in the case of, unfortunately, many women of color, to be diagnosed when it's too late because nobody listened to them in the beginning. I need you to love you, and I need you to find a doctor who is going to treat you with the love that you need so that you don't end up where I did. The doctor that I followed over to the clinic in another area unfortunately ended up moving away entirely to a different part of the state. I then requested a referral from my insurance to the closest gynecologist oncologist that was not Dr. Beast over here. I actually got a referral up to Stanford. I have been working with a phenomenal gynecologist oncologist since then. It was difficult at first. If the man so much as touched me, I would jolt. I was terrified because of the undue pain that Dr. Beast over there put me through. I love my new gynecologist oncologist. He has been phenomenal. He has been patient. Despite the fact that I did not bring my surgery to him for him to charge my insurance and get all the money out of, he never treated me in a way that was unprofessional. He has never been unkind. He has always listened to my concerns about pain, listened to my concerns about emotions, asked very important questions about intimacy with my husband to make sure that everything on that field is going okay and that I'm not having any problems. I feel respected and I feel listened to. And I am going to see him next month for my 4-year checkup. I have seen him every 6 months for the last, goodness, I think this will be the third year, either 2.5 or 3 years now at this point. He always gets imaging done first. That involves a ultrasound. So I get an abdominal and an internal ultrasound done. That information is then shared with my gynecologist, who goes over any symptoms, none of which I've had, thank God. No bleeding, which is, according to my support group that I'm still a part of, it seems to be the #1 indication of recurrence. Luckily, I've had no bleeding, no unexplained pain, bloating symptoms that are separate from, typical life and diet and PCOS. I continue to be healthy. Hopefully, next month's visit will be pretty much the same. Again, from all the outcome of my surgery, it looks like there's really no reason to suspect that the cancer would come back. So once I hit the 5-year mark, I will be down to annual visits, which I am very excited for, because the appointment days are still anxiety inducing because it's cancer. It's never not going to be a part of me, but every day it's easier as time goes on and as I get more and more results back stating that there's no cause for concern. I breathe just a little bit deeper now. I don't know if I mentioned on previous videos, but I did get to keep my ovaries. And my husband and I have gone through IVF, and we are now embarking on a surrogacy journey. So I am actually going to begin 2 different series One will be to talk about the IVF journey and what that was like for us. And then finally, I will get to what surrogacy is looking like right now. Um, I want you to know that it gets better sometimes. I don't want to say it always gets better because unfortunately, I have lost friends from my support group. Um, Sometimes we lose people, sometimes people lose the fight. And cancer never gives, it only takes away. So, for those who we have loved and lost, you're still with us and we miss you. And for those of us that are still here and still fighting and can actually beat this thing, it gets better. Reach out for anything. Send a message, put in a comment, share it with somebody that you know in a support group or wherever you need, if you feel like any of this information is beneficial to them. Always advocate for yourself. Find somebody that will advocate for you and or be the advocate for somebody who needs you. No doctor's appointment when you have cancer should ever be attended alone. I know that COVID made it really, really hard for some people, but COVID times have officially been declared over. So there is no excuse anymore not to have an ally in your corner. And damn it, we are women, hear us roar. The medical community is going to begin to understand that when something is wrong, when we say something is wrong, it's not because we're emotional. It has nothing to do with our hormones. We are going to be validated and we're going to be taken care of. And that's because we decided. So make that decision for yourself. More to come in the future. Probably not today. I have a ton more things that I have to do today, but I hope that everybody's well and still surviving and still fighting. And if you happen to stumble across my video series while you still have cancer, just know that I am a friend to you and you can talk to me about anything. Any of those feelings that you don't want to share with other people, I'll listen to because I get it. And even if everybody else in the world tells you otherwise, those feelings are valid and you are valid. That's it. Talk to you guys later. Bye.